Envision your body as a sugar bowl. This was explained by Dr. Jason Fung, and this metaphorical sugar bowl starts out empty at birth and then gradually fills up as we consume carbohydrates and sugars. When we overindulge in carbs and sugars, it leads to a rapid filling of our sugar bowl. This directly impacts our body's ability to handle glucose. And in some cases, it takes as little as 10 to 15 years for our sugar bowl to overflow. This is why we see a rise of type 2 diabetes among children and teenagers. As we've seen, insulin is the hormone responsible for opening our cells' doorways, allowing glucose to enter and be used for energy. So, what does all of this have to do with insulin resistance? Well, insulin resistance is much like trying to add more clothes to an already full suitcase. Your cells are full of glucose, and just like you can't keep forcing clothes into an already full suitcase, is the same way you can't keep forcing glucose into an already full cell. When the cells are full, they become resistant to insulin's signals, and then the glucose starts to hang out in our bloodstream, causing high blood sugar levels. This is usually the point where your doctor will diagnose you with type 2 diabetes. So what's next? To address this issue, you must first remove some of the glucose from your cells. This way, the cell can operate more efficiently and accept more glucose. Current practice, however, states that after a patient is diagnosed with type 2 diabetes, the next step is to usually prescribe medication. Now, glucose-lowering medications, they are effective, and they do reduce the amount of glucose in the blood, but mostly because the medications relocate the glucose into other organs, instead of getting to the root cause of having too much glucose in the cells. Be sure to stay tuned and learn more about how to remove excess glucose from your cells.